Schizophrenia literally means fragmented brain. It represents a heterogeneous syndrome of disorganized thoughts, delusion, hallucination, and impaired psychosocial functioning. Etiology and pathogenesis of schizophrenia. Neurotransmitter hypothesis, which includes dopamine hypothesis, excessive dopamine level, dopamine and serotonin, excessive level of dopamine and serotonin, glutamate, GABA, acetylcholine, norepinephrine are also implicated. The genetic factors like increased risk in family members, Dijor syndrome, neuropathological factors like cerebral ventricles, reduction in the cortical gray matter and enlargement of the ventricles, limbic system, structural and functional abnormalities, abnormalities in the prefrontal cortex, basal ganglia, and cerebellum. Environmental factors like stressful life events, exposure to influenza virus, advancing paternal ages, drug abuse, obstetric complications. Symptoms are positive symptoms include delusion and hallucination, which have the good prognostic factors. Most common delusion is a persecution. Most common hallucination is auditory hallucination. Negative symptoms include apathy and hedonia, avolition, alogia, and affective flattening. Disorganized symptoms are disorganized behavior, disorganized speech and thinking. Motor symptoms include stupor, excitement, posturing, waxy flexibility, echolalia, echopraxia, negativism, grimacing. Patient may have suicidal thoughts and violation. Diagnosis is based on DSM-5, which includes delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms. 2 out of these 5 symptoms, or at least 1 out of delusion, hallucination, or disorganized speech, which is present for 1 month, and total duration of illness is 6 months. Type of schizophrenia are paranoid schizophrenia, which is the most common. There is predominant positive symptoms. It is late onset. In this, personality is present. Catatonic schizophrenia with predominant motor symptoms, which have the best prognosis. Treatment of the catatonic schizophrenia is IV lorazepam and electroconvulsive therapy. Hebephrenic schizophrenia is disorganized and negative symptoms, which is bad prognosis. Simple schizophrenia, there is in simple schizophrenia there is a predominant negative symptoms which have the worst prognosis. Residual schizophrenia, status and minimal hallucination. Treatment includes, for the severe symptoms, hospitalization is mandatory. First line drug for schizophrenia is the antipsychotic, like a typical or first generation antipsychotic, atypical or second generation antipsychotics. Duration for the treatment is, if it is a first episode, then it is for 1 to 2 years. If it is multiple episode, then 5 years. Typical antipsychotic drugs are chlorpromazine, flufenazine, thiotixine, haloperidol, droperidol, penflurodol, loxapine. Atypical antipsychotics are clozapine, olanzapine, risperidone, quetiapine, aripiprazole, amisulpride. Psychosocial treatment include supportive employment, skill training, cognitive behavior therapy, family interventions.